So let me explain the format for today. We are going to see the same case, but we're going to see it manifested itself three different ways, with a Nigerian patient first, a Mexican patient second, and then a Russian patient third. And just to explain the format, you are going to see the vignette, and then what we're going to do is we're going to have a facilitated discussion where you all kind of talk about what you noticed in the vignette, and specifically we're looking at how cultural differences impact the communication of the scene. Then, of course, we'll check in with our characters. Then we'll turn to you for suggestions on how to improve the vignette, to how to improve the interaction, and our actors will take those suggestions and play it out again. So is that format making sense to all you all? Wonderful. Doug, would you like to do the case?
So this is, I think, tab 2 in your handbook. The patient is a 36-year-old with a 10-year history of mid to lower generalized abdominal cramp-like pain that is made worse after eating. The pain is associated with looser and more frequent stools, and there is some relief of pain after defecation. Associated with this is a sensation of abdominal bloating and occasional nausea. The symptoms occurred several times a month without much loss of ability to work or engage in usual activities, and there will be some variation with the cases. Beginning about 6 months ago, after some traveling, here it is, the patient developed a more acute and severe episode of abdominal pain and watery diarrhea with fever and chills. Since that time, the patient has continued with nearly constant symptoms with loose, at times watery stools, bloating, and pain. There have been several episodes of urge incontinence, which the patient is somewhat embarrassed to discuss. Recently, the patient has cut back on eating and has lost 5 kilograms, it says. The patient saw the family physician 2 weeks ago, who found no abnormalities on physical exam. The blood work, including CBC, sedimentation rate, CRP, serum TTG, electrolytes, and liver chemistries were normal. Stool culture for bacterial infection and O&P were negative. A barium enema and CT scan were normal. During the interview, the patient appears quite anxious and notes inability to carry on usual work or social activities because of symptoms. This has led to limited activities outside of the home.
Okay, so for our first vignette, we have the doctor will be played by Dr. Drossman, and the Nigerian patient will be played by Dr. Ademola Aderoju.
Hi, I'm Dr. Drossman.
Hi, Dr. Drossman. I'm Ademola Aderoju.
Ademola?
Ademola Aderoju.
Are you African?
Actually, it's Nigerian.
Oh, I'm sorry, I can't always pick up the right accent.
That's all right. Some people think all Africans sound alike anyway, so that's fine.
Okay. Well, anyway, tell me what brings you here, how I can help you.
Well, Dr. Drossman, the reason I'm here to see you is because I have this heaviness in my stomach, and I've had this problem for probably about 10 years now. And I have seen so many different doctors, and no one has been able to figure it out. And the last doctor that I saw told me that I should come and see you, that you would get it fixed, and that's why I'm here.
Well, I'm here to help.
Okay.
You said heaviness. What kind of pain is this?
Well, it's just a real uncomfortable feeling right here, in my stomach right here.
Okay. Are there any problem with your bowels?
Well, I mean, not really.
I mean, do you have diarrhea or constipation? That can go along with this, you know.
Well, I guess you could say
Do you need someone to write? I can't
probably.
write.
Probably diarrhea or constipation or both?
I guess a little bit of probably a little bit of diarrhea.
Diarrhea. Okay, and is it really bad?
Yeah, sometimes.
I mean, so bad that you can't get to the bathroom?
Well, probably, yeah.
Probably you can't get to the bathroom?
Yeah. I guess probably could say that, yes.
I mean, are you incontinent? Do you have incontinence?
No, I wouldn't say that has been a problem, no.
Okay, all right. So you've had some diarrhea and you've had some pain. And tell me a little bit about what you think could be causing this.
Well, I wish I knew. I mean, my mother has her own ideas about what is going on. And, I recently moved out. I've, lived with my mother for a very long time. And I recently moved out to stay with my fiancé. And my mother thinks it has something to do with the change in my diet. I've always eaten the traditional Nigerian foods, and now I'm living with my fiancé, eating more of a Western type diet. So she thinks that's what the problem is. Of course, my fiancé will have nothing of that. So I don't know. This is also confusing to me. That's why I'm here to see you, so that you can help me fix this.
I know. What do you think is going on? That's what I really want to know.
I really don't know. I mean, I've been told all kinds of things. I mean, my mom thinks this may be something spiritual. She actually didn't want me to come here and see you. She was going to take me to church and see if I could get prayed for.
Okay. Do you have any sense of what's going on in your own mind?
No, Dr. Drossman. I mean, that's why I'm here to see you. I mean, I'm just so confused.
Okay,
I
all right.
have
Well,
no
I
idea
think
what's going on.
I think we'll go ahead. I mean, from what I can see from the records, it looks like you probably have irritable bowel, and we're going to probably go ahead and do an exam and see if that's what it is.
Okay.
And I think what's good to know is that we have ways that we can treat this. You've been having diarrhea, and we can give you some loperamide to slow down the diarrhea, and we can sometimes give you also probiotics to kind of relax the stomach. Sometimes we can give you antispasmodics. Do you have any preferences for any of them?
Well, I mean, I wouldn't say that I have a preference. I mean, I just want to take something that's going to make this go away. So whatever you think is going to work is what I'm going to take.
And sometimes we use them in combination. So, you can deal with the diarrhea with one, like the loperamide, and then you can have the anticholinergic on top of that. Do you have any problems with taking combinations of medications?
I mean, I'm not sure that I understand the differences between these medicines, but...
All right. Well, you have a lot of pain. Is that right?
Yes, there's a lot of pain with this.
Okay.
Absolutely.
Now, we do have the use of antidepressants to control the pain. This can be very helpful in kind of calming down the discomfort that you're having.
I'm not quite sure I understand. I mean, I wouldn't consider myself depressed. I don't think this is a depression issue.
No, I wasn't saying you were depressed. This can be used for treating the pain.
I just want you to give me medicine to help the pain. Okay?
Okay. I think our time's going to be over. I want to go ahead and do the physical exam, and then what we can do is we can talk about the medications afterwards. Okay?
Okay.
All right.
What did you notice in this interaction about the kind of dynamic of communication, and maybe with kind of an eye on the cultural aspect and cultural differences?
I noticed a lot of interrupting.
Right. So there was a lot of interrupting, and the doctor was frustrated. Why did it seem like the doctor was frustrated? He seemed to be frustrated by something that the patient was doing. What was that?
He was talking. The patient was just talking to him about what his mother thought and other things, and he kept interrupting and saying things.
Okay. So one thing that might have frustrated the doctor, first of all, his general talking and the way he described it, and we might explore that more a bit, but he raised the idea of the mother. Okay, so we have two things going on. We definitely are going to want to talk about the mother. I feel like someone over here was about to comment on what was frustrating the doctor. Were they? Go ahead.
Well, his answers were always probably. They were yes or no, and he wanted a
Good. So one thing we noticed is that there was no kind of definitive answers. There was a lot of kind of hedging. It seemed like maybe he was uncomfortable with talking about kind of his GI symptoms. And also, I think probably, what was he consistently doing? It seemed like the doctor, on the one hand, was trying to include him. What was he trying to do?
Trying to get the doctor to tell him what the treatment should be.
Yeah. So it seemed like the patient kept going, that's why I'm here. You tell me. He kept kind of, how he was abdicating control, abdicating authority. Go ahead.
I just wanted to say, at the beginning with the name, that was the first thing that started an interaction that was not so positive.
There was a very negative interaction around the name, and someone's name is a very powerful thing. I mean, especially at the beginning of an interview. But then there was also something around like nationality, right? Oh, you must be African, and he responded, I'm Nigerian. It seemed like in that case almost like the national identity trumped the continent identity. That might be something we keep in mind. Let's go to the mother. What did you all notice about his discussion of the mother?
For the patient, her perspective is significant to him, and it got completely, I don't want to say dismissed, but the doctor was more focused on, no, not your mother, what do you think?
Right.
And there's a spirituality component of this that was also dismissed.
Right. So two things were dismissed. First of all, the mother's opinion clearly had an impact on him and how he approached his care. And just second of all, the mother was very invested in spirituality. And so that might be something that the doctor honors versus dismisses. I just want to check in with Mr. Aderju. How did you feel about your interaction with Dr. Drossman?
It was less than satisfying. I didn't feel like I was able to get my story out. And it seemed to me that, this was his agenda. I couldn't complete sentences. And I just felt very unfulfilled at the end of the discussion. And he said, well, let's just go ahead and do the physical exam and we'll, try and figure all of this out. So the issues that I was concerned about, including this question of using antidepressants, which I don't understand, because this visit is not for depression. It's because I'm having pain. So,
Great. So, Dr. Drossman, how did you feel the interaction went?
I don't think he was a good historian. I think that I was doing all the things I'm supposed to do. Asking open-ended questions. I'm trying to do patient-centered care. I'm asking him choices, and I can't get him to go anywhere, and I just gave up. And I just said, just work him up.
Great, wonderful.
Do the colonoscopy and be done with it.
Great, wonderful. Anyway, so now that we've checked in with Mr. Aderju and we've checked in with Dr. Drossman, there does seem to be a disconnect. And for some of the reasons that we mentioned, how might Dr. Drossman improve? How can we help himself to get the information that he wants?
Don't look at your watch.
Good. So Dr. Drossman, apparently you might have checked your watch at one point?
I've got 20 patients in a day.
So there were interruptions, and obviously there was kind of a cultural difference on who. It seemed to me there was a difference in terms of like who was in charge and who was responsible for providing information or providing care. And so and I don't need to come up with the suggestions, but one was that there were interruptions. That might be the doctor was frustrated, didn't want to listen to the theories of the patient's mother, didn't like vague answers. We noted that the intro started off poorly, that the mother's thoughts were dismissed. There's spirituality which wasn't addressed. The patient said he was unfulfilled. So again, we're at suggestions, and then we'll go ahead and see it again. But let's give this doctor something that he can improve upon.
He was talking to the patient and talking about different medications, but he was using sort of the pharmaceutical names, which I'm sure that the patient had no idea what he was talking about.
Great. So maybe, doctor, you might use more. You might either use more common names for the medicine, or you might explain what those medicines are for. What else?
Yeah, he also used medical terminology.
And there are two things going there. First of all, incontinence is this big word that patients might not know. Second of all, there was so much hesitation to discuss his own symptoms that to throw out incontinence there and challenge someone like that might be off-putting. Other suggestions on how we can improve before we see it again?
Well, maybe if the physician explained how they had to work together to solve the problem so that we engage to cooperate.
A merging of agendas and naming that. Great.
So there are two things. First off, when he brought up antidepressants, the doctor, and he said, I'm not depressed, the doctor did not explain how an antidepressant deals with pain, not depression, to validate the question and to give a little explanation. And then, secondly, on spiritual issues, there's a lot of people that feel very strongly about prayer and spirituality, and not to acknowledge that or even discuss it in any way, shape, or form may shut the patient down.
Okay. So, doctor, another suggestion might be is to kind of to validate his spirituality, his family's spirituality, and those concerns. And again, I'm just going to build on this list. Doctor, you might. We noticed that you interrupted a lot, and you might want to address that. Doctor, would you like to give it another shot?
Okay. Hi, I'm Dr. Drossman.
Hi, Dr. Drossman. Ademola Aderoju.
Hello, how are you?
Fine, thank you.
I'm hearing an accent. Where are you from originally?
Oh, I'm Nigerian.
Nigerian.
Yeah.
How long have you been here?
I've been here probably about 10 years now.
What brought you here? What are you doing now?
Oh, I came here to go to graduate school, and I actually took a little longer than I thought it would, but I'm done now, and I just got a new job, and so.
Very good. And I understand you're here for some health problems. Tell me a little bit about it.
Yeah, my doctor asked me to come and see you. Actually, I've seen quite a few doctors for this problem, and essentially, I have this. I would call it a heaviness in my stomach that's been a problem for many years now. I've seen many doctors, and no one has been able to figure it out. So the last doctor I saw asked me to come and see you, and said that you would fix this.
I understand. A heaviness. Anything else?
Well, that's mostly it.
Well, sometimes people can have bowel problems with this, so either diarrhea or constipation. Has any of that happened with you?
Well, I guess you could say that I have a little bit of diarrhea, yes.
Okay. I understand this could be hard to talk about, but it's helpful that you're able to tell me about that.
Okay.
How bad has the diarrhea been?
It can be pretty bad at times.
I mean, bad enough that you may not quite make it?
I'm not sure what you mean by that, Dr. Drossman.
Well, sometimes people have to rush to the bathroom because it's coming out too fast.
Yeah, I guess you could say that has happened a couple of times.
Well, that must be very hard to experience.
Yes, it's been very difficult.
Okay, well, we'll work on that, see if we can get things under better control. You've been to a lot of doctors. What are your thoughts about what could be going on?
I wish I knew. My mother has her ideas about what is causing this, and she thinks it has to do with the food I'm now eating.
I see.
I recently moved out of my mom's home, and I'm now living with my fiancé.
Where is your mother?
Well, she lives here locally.
Okay.
And I've lived with her for many years, and I ate at the house, and mostly the traditional Nigerian foods.
Oh.
But now I'm eating more of a Western type diet, and she's convinced. She's convinced that is what is causing this.
Well, that's a big change to go from one food to the other.
Yes, it is. My fiancé obviously doesn't think that has anything to do with it, and that itself is a problem because it's just the back and forth, and and all this stuff happens, and that itself makes my symptoms worse sometimes. So I don't understand this.
It sounds like you're kind of caught between your mother and your fiance on this as well.
Yes.
That is stressful. What else? Anything else that could be contributing?
Well, I mean, there's this other element. My mother also thinks that there may be a spiritual element to this, and she actually thought that I should go to church, and she would have this addressed by the church members, and they would pray for this, and it would make it go away. And she didn't think I should come here and see you. She thought this was an absolute waste of time.
Oh, that's difficult too. Where are you in terms of your spirituality and your belief in what your mother's saying?
I'm confused. I don't know what's going on.
Okay.
But I was told to come and see you, and I said I was going to come and see you, and I believe that you can fix this.
Okay. Well, I will do what I can. There's room for other kinds of treatments as well, so we can talk more about that later.
Okay.
And so I've been looking at the records, and it does seem like you may have irritable bowel syndrome. We want to confirm that with some tests. You also said before that you think that these conflicts can make your symptoms worse as well.
Yes, that is right. Absolutely.
Okay. Well, we're going to try to look at options for treatment. I mean, one of the things we sometimes use is a medicine to slow down the diarrhea, something for the pain.
Okay.
Are you okay with that?
As long as it works. I'm willing to try anything that you think will fix this.
Okay. Well, I'm going to do that. I'm going to come up with some suggestions. We'll work together on this because if I need to know from you too if something's not working well, and then we can look at other options.
Okay, that sounds fine with me.
One thing also to mention with your pain, sometimes we do use antidepressants. Antidepressants can be helpful for this kind of pain.
Yeah, but I'm not sure I understand why you want to use antidepressants. I'm not here for depression. I'm here because of the pain.
That's right. And, just like aspirin can be used for a heart attack, to prevent a heart attack, or for pain,
Okay.
Antidepressants have chemicals that work in different ways. In larger doses, it can be used for depression, but even in smaller doses, it can be used to help control the pain, even if you're not depressed.
Oh, I see. Okay.
All right. Well, why don't we go ahead and do a physical exam, and then we'll talk some more.
Okay.
Okay.
Let's give him a round of applause. So, help me out. What were some adjustments that Dr. Drossman made this time around with this gentleman from Nigeria?
He was more empathic. He knew that it was a subject that the patient didn't really want to talk about. So he said, I know this is difficult to talk about.
Wonderful. He was more empathic, recognizing the discomfort and allowing space for that. Let's go here and then over there.
At the beginning, he asked, where are you from, not, are you African?
Right. Again, a simple technique that we would use in any case, an open-ended question, but it very much serves to avoid any kind of cultural discomfort or discomfort around cultural issues.
Well, I was going to bring up the same thing and show an interest in him as an individual.
Right. Relationship building can be very helpful in a cultural context. In addition, it seemed to me that this time around, yes, he might have been a better historian, but even if he had not been a better historian, the fact that he wasn't, you let it roll off your shoulders instead of, fighting that battle. And by letting it roll off your shoulders, it allowed him the space to be a better historian. What other adjustments did he make?
He was respectful of mother and just spiritual.
Right.
He actually embraced it for his patient.
Absolutely. He embraced the conflict. He validated that it was probably difficult for the patient. And then, as you said, he validated the spirituality and its role, which can be very helpful. Wonderful. Let's give him a round of applause.
Good.